Hello, my name is Hanna Klushnik, and this is a video demonstration of instructing a patient with an above knee amputation into proper positioning in bed. I will be demonstrating visually because I do not have a patient to instruct with my cues verbally and tactile cues. The patient has an above knee amputation on the right side, and it's his third day after the surgery. Or he had the surgery 3 days ago. Okay, Mr. Smith, I'm going to show you how to position yourself in bed to prevent tightening of the muscles and the tissues in your right hip joint, which can lead to a contracture, which we don't want to have because you need to have full range of motion at your hip joint in order to use the prosthesis when it is time to do so. So I'm going to start showing you in the position lying on your back. When you're on your back in bed, you want to have nothing under your residual limb. So don't put any pillows at the tip. Have it as flat as possible to maintain that nice neutral position of the hip joint. The only time when you do want to have something propped underneath your residual limb is when you notice there's a lot of swelling happening. So then you want to elevate it above the heart and keep it there for 20 to 30 minutes. But no more than that. Try not to have it just propped up by a pillow throughout the day. So we want to avoid putting too much pressure into your residual limb by rolling onto your involved side, although that's another way to do this technique eventually when your wound heals a little bit more. So I'm going to be showing you how to get into the prone, what is called prone position, or lying on your belly, going on the other side. So you're going to bend your uninvolved or intact leg, and then pushing with the heel, slightly lift the hips as you bring your arm over, and then start rolling to the side. And then from here, you can use your hands to lift your trunk, and then extending the intact limb, slowly transition to the belly. Once you're here, make sure there is nothing underneath your hips. They want to be as flat on the bed as possible. That's the purpose of lying on the stomach. And then you can use pillows to make it comfortable for your trunk and your head. So if you are to stay here reading a book or looking at your phone, then you can have a pillow underneath the chest. You can also use it for your head. Let's say if you're watching TV on this side or talking to somebody. You want to be in this position for 20 to 30 minutes, 3 to 5 times a day. Ideally, no less than 3 times a day, just because you want to make sure that the hips have enough time to straighten from whatever you have been doing before. And when it is time for you to go back, slowly start pushing into your elbow, coming onto the side, and then we're going to roll back up. You can bend your intact limb and then pushing into the heel, lifting the hips a little bit, come back on to your back, and then extend this leg, again making sure everything is nice and flat. So this concludes my demonstration, and then I would ask the patient if he has any questions. I would have him try the technique and then provide any visual or verbal or tactile cues as needed. Thank you.